since yesterday. Again, the majority of those cases are in Victoria, and almost all of those are in the Greater Melbourne and Mitchell Shire. So for New South Wales, 15 new cases. Several of those are in hotel quarantine. Most of the rest are associated with the Crossroads Hotel or a Thai restaurant quite close to that same area in southwest Sydney. There are several cases that are still under investigation there. In Victoria, 217 cases, the majority of those locally acquired, majority of those are still under investigation, as are a large number of cases from the previous days. In WA, one new case in hotel quarantine from an overseas arrival. Total deaths, 118 Australians have died of COVID-19, including 2 new deaths, both people in their 80s in Victoria. The majority of cases, of course, have recovered, although there are now approximately 2,700 active cases of COVID-19. Again, almost all of those in the Greater Melbourne and Mitchell Shire. We have at the moment 116 hospitalised cases. That is a little lower than yesterday. In intensive care, 26. Again, that has decreased since yesterday. A large number of tests continue to be made every day, well over 20,000 tests in both in Victoria and similarly in New South Wales in the past 24 hours. So extraordinary number of tests being done, being targeted at those places where we know there are outbreaks and those that are associated with those outbreaks, such as close contacts and so on. Over 3.4 million tests have been done so far in Australia against this virus, and 63,000 just in the last 24-hour period. So I think that we can see that there is a good decrease there in the number of cases in Victoria. I would caution to say that we should see that this is over. It is certainly not over in Victoria. We have a large, widespread community outbreak, mainly in Melbourne, but also some cases appearing in the rural parts of the state. And so I'm encouraged to see that the Victorian government has dispatched further testing facilities and contact tracing expertise into the rural areas. I think that's a very important component of this control. And in New South Wales, again, extraordinarily good and strong contact tracing and case finding efforts, really chasing down all of those chains of transmission to decrease the chance of this local transmission being more widely spread in New South Wales. So I'll take questions firstly from the room.
In terms of politicians returning to Canberra, in the past when we've asked about this, your colleagues, the Deputy CMOs, have said it's a matter for the ACT Health Department. So what's changed, or what prompted you to provide advice to the Prime Minister?
So I've been in very close discussion over the last couple of weeks, really, with my colleague Karen Coleman, the Chief Health Officer in the ACT, about this matter. Of course, the ACT has, as all of the states and territories have, restrictions on people coming from Victoria. And so we were looking to see what could be put in place that would be reasonable for politicians to be able to come for that sitting that was due in August. And those from Victoria, of which there's a substantial number, both members of Parliament and senators, that would balance that risk to the ACT community and within Parliament House itself, and indeed the government processes for the country, with the risk that could be posed by those people from Victoria on one hand, and the need to have those functions to continue in our democracy. So yesterday I was asked by the Prime Minister to give specific advice to him about these matters, and that was provided, and he was in touch with the Leader of the Opposition, the Greens, and also the presiding officers of the Senate and Parliament, and the presiding officers of the Parliament, the Speaker and the President of the Senate. And the decision was made that, given the risk from Victoria at this time, likely to still be a risk at that time, and the emerging situation in southwest Sydney, it was deemed that that sitting should be delayed.